Hello. Today we're gonna discuss about very simple thing, which is the anatomy of the nose. I'm gonna start with the surface anatomy. In this picture, is the patient of mine about a year and a half ago. I already informed her consent to use this picture in this video. I'm gonna start with the top to the bottom. The first one is the shallowest part of your nose, and which means the shallowest part of your face as well is here. We call this part radix. Radix is where your nose start to take off, and for this one, we call it a dorsum. Is the dorsal part of your nose, and on both sides of the dorsum we call this one a side wall. On the top of the dorsum here, inside is the bony part, which is the nasal bone, and more lateral, which is around this part, is gonna be maxilla bone. For this one, it's not a bone, it's the upper lateral cartilage on the both side, and in the middle is gonna be your nasal septum. So, lower than that, here is the lower lateral cartilage. As I mentioned earlier, is the upper lateral cartilage, and here is the lower lateral cartilage. What we call this part as a tip, along the dorsum and the tip. For some people, between the dorsum and the tip, there is a little notch called sublar tip break. And then after the tip, here, this part, we call it columella. And here, before we reach the ala here, we call this part soft triangle. And here is a nostril shoal. For lower lateral cartilage, it's divided into three parts. The first one is the middle clues, which is here, and intermediate clues is around your soft triangle, and the last one is the lateral clues is over here, over the ala cartilage here. So yeah, once we know each part, what we call it, so when we see each other, it would be easier to discuss about what we're gonna do with your nose. Okay, bye.